Hi, my name is Greg White. I'm the CEO of Lamprey Health Care. We are what's called a federally qualified health center with locations in southeastern New Hampshire, most notably Newmarket and Raymond. As such, we are what's considered a safety net provider for the purposes of access to primary health care, primary behavioral health care, and substance use treatment services. In our capacity, it is our mission to provide care to everyone, to do so without regard to their ability to pay. We're here for everybody. Since last March, we've had to ramp ourselves down in response to the COVID pandemic. Typically, we see about 60,000 visits annually in terms of patient visits, and in an industry that's driven by volume, that equates to almost $1 million for us. So when you run an operation that's generally around break even, more or less, that kind of revenue hit, it's hard to sustain, particularly for those services that aren't typically reimbursed through that mechanism. As part of that, we've had to furlough staff, put a number of staff onto remote workforce status. We implemented telehealth. We've seen our volume go from well over 1,000 visits a week down to about 400 visits a week. And since that time, we've brought it back, almost. We've had to ramp down a number of programs in response to the pandemic, notably our transportation program. We had to suspend operations of our school-based dental program. We've had to pivot and provide testing in our parking lots. We were open throughout the pandemic to do testing not only for our patients, but for the community, for healthcare workers, and for first responders. So we've had to think outside the box a little bit. As part of this, we've also started doing community immunizations in our parking lot, in people's cars. We're really looking forward to taking our mobile health van on the road. And with that, we'll be able to bring our immunizations, our testing, even our behavioral health and medical health services out into the community where patients are. So most notably, I think, we feel there's an opportunity there. I think some of our challenges may be that our healthcare reimbursement system is not caught up to this modality. Certainly, we understand better now that we have an opportunity to get out into the community, to deliver our services outside of our four walls. And I think we've proven we can do that.